Are there alternatives to frequent endoscopy for esophageal varices? Managing esophageal varices often involves regular endoscopies to check for new or recurring varices and to treat existing ones. But what if there are ways to reduce how often these procedures are needed? Let's explore the facts. One of the main alternatives is the use of medications called non-selective beta blockers, such as propranolol or nadolol. These drugs work by lowering the pressure in the portal vein, which is the blood vessel that carries blood from the intestines to the liver. When this pressure decreases, the risk of varices bleeding drops. Many doctors prescribe beta blockers as a first step to prevent bleeding, which can sometimes lessen the need for frequent endoscopies. Endoscopic variceal ligation is another key treatment. It involves placing tiny rubber bands around the varices to cut off their blood supply. This procedure is effective at eradicating varices and preventing bleeding. Usually, several sessions are needed, spaced every few weeks, until the varices are gone. After that, doctors recommend follow-up endoscopies to check for recurrence. The interval between these follow-ups can be adjusted based on the patient's risk factors and how well they respond to treatment. Some newer techniques combine ligation with other methods, like injecting a sclerosant, a medicine that causes the blood vessels to close off. This combination can sometimes reduce the chance of varices coming back, which might mean fewer procedures over time. While endoscopy remains the gold standard for detecting and treating esophageal varices, researchers are exploring non-invasive ways to monitor portal hypertension, such as elastography, which measures liver stiffness. These tools can help doctors decide when endoscopy is really necessary, but they are not yet replacements for the procedure. In emergency situations, other treatments like balloon tamponade or transjugular intrahepatic portosystemic shunt are used. These are reserved for severe bleeding or when standard endoscopic treatments do not work. They are not routine alternatives but important options for specific cases. Some experimental approaches, like injecting hypertonic dextrose into gastric varices, are being studied but are not standard practice for esophageal varices yet. In summary, medications like beta blockers and certain combined endoscopic techniques can help lower the frequency of endoscopies needed for managing esophageal varices. They are not complete replacements but valuable tools to reduce invasive procedures. It's essential for patients to work closely with their hepatology team to develop a personalized plan that balances safety and effectiveness. Always remember, each case is unique, and ongoing research continues to improve how we prevent and treat these complications of liver disease. If you or someone you know has esophageal varices, consult a healthcare professional to determine the best approach for your specific situation.